As we may see, we started to analyze very deeply the situation of HIV in the late of the 80s, but in the beginning of the 90s we had an outbreak, and we saw that some 100 children been affected by HIV. So we go further and we elaborated the national plan to fight against HIV and AIDS. And in this very moment, we may say that all those efforts has been recognized at the international level. Unfortunately, due to the crisis, and everybody was affected by the crisis, a lot of behavior changed in the specific groups. And in the younger people, we have right now an incidence of 2.3% at 100,000 people, despite that in the general population we have 0.014. So it's a huge difference for the general population with this specific group, and the data comes for the end of December last year. So in this very moment we care for more than 12,000 people touched by HIV and AIDS, and the subtype initially was subtype F1. In such a context, of course, the people grow up, they receive medication, they've been included in the national programs, and 60% of them are alive and represent the former cohort of children infected at the late of the 80s. But during this time, we find out that, and we learn tons of data. And we saw that we are not just an island in Europe due to the fact that we are F1, but we are also an island from the point of view that we are in connection with Portugal, Spain, Greece, and Bulgaria, for another CRF that we will show a little bit later. So from this category of patients, if we are looking to the CE countries, we recognize that Romania has an important play to role, with more than 8,000 people representing 72% of the general population, according to the other countries that you may see on the slide. So what we have in this very moment, we discuss about more than 19,000 people from the 1985 till our days. So in this period of time, we lost more than 6,000 people, but almost 12,000 are alive and in the good shape. And as you may see, more than 10,000 people under our antiretroviral therapy. But what is important, we discover really something like 700 new cases. But 700 cases are not only new infected cases, but are old infected cases, which right now they present like late presenters. And when we are looking to the groups of age that they are included here, you may see that we discuss about the 20 to 49 years old, the main important cases, and the male represents the majority. So if we are looking to the statistic in Europe, you see that Romania is in the pole position with the most patients registered, but we have to tell you that, I repeat, they are not newly infected cases, they are newly diagnosed cases, because they belong to the cohort. And if you are looking here, you may say exactly, sorry, you may see here how this cohort is represented due to the fact that there was an important change. You see on the left side how the pyramid of age looks at the 80s and how it looks in this very moment. It's a total difference. So, do we have any specific challenge? Yes, of course we have, because it's an old cohort, and this old cohort recognize therapeutic fatigue. We have the problem with that vertical transmission, and in Romania we have a national program to prevent vertical transmission, and despite our effort, we still have something like less than 5% vertical transmission. We have the use of antiretroviral drugs because they like to have a very short therapy if it's possible for 1 week or 12 weeks in hepatitis, like in hepatitis C. Unfortunately, something like this in antiretroviral therapy does not exist in this moment, but we are looking carefully for the future. And what we have new is the IV drug users. In the last 4 years, our epidemiology data changed dramatically due to the fact that IV drug users came up on the market. And they don't came up just like this, they came up with CRF, it's CRF 14BG, And this CRF14BG has a particularity, it's CCR4, it's not CCR5. In this context, the evolution of the infection is more progressive, more rapid, and with a lot of side effects. The vertical transmission, it's less than 5%, as I mentioned previously, and we have a pool of patients which are important and treated regularly. In 2001, we started to treat the patient, doesn't matter the level of CD4. I mentioned this in Geneva, and the data, they told me that it's not affordable. 10 years later, in Washington, D.C., Mrs. Clinton, taking a report from WHO, mentions that the antiretroviral therapy is supposed to be used as a method to prevent the transmission and the spread of the virus in the population. We have done this from 2001, and the results you saw it. But we have a dynamics in the epidemics, and you saw that new category of patients came up on the scale, and if at the beginning we had heterosexual transmission, right now we have a MSM, and we have this IV drug users, which put us a lot of problems. And they put problems because if see in 2009, they used 97% heroin. After 1 year, they switched from the heroin to amphetamines derivatives, more than 30%. This switch, that means that they replace it 2 injections per day with 14, 15, 20 injections per day. Doesn't matter what program of change of syringes you put in place, the result is there, and the result was the transmission of HIV and of course of hepatitis C. And on the bottom you see in 2014 that we have 82% HIV plus hepatitis C virus, 1.8% HIV plus hepatitis B, a combination 8% with HIV, Hep C, Hep B, and of course other sexually transmitted, and of course tuberculosis. If for the HIV we discuss about subtype F1, for the IV drug users we discuss about many other subtypes, and this F1 dropped to 70%. So for the 90% to 70%, which was an important switch in the epidemiologic data. What kind of persons are more affected by this plague, this new plague? Well, in general, they are male. The clinical stage is 1, but 30% of them are in prison. So here it's a difficult to entry as a non-justice official, and it's difficult to develop the local program. But also the Department of Justice in Romania developed their own local programs separate from the national strategy to prevent the transmission of HIV and Hep C in prison. And another characteristic of them, more than 20% are infected with this CRF14BG, and CRF between 14BG, it's in connections with Portugal, Spain, Greece, and Bulgaria, and you see also Romania. So in the south of Europe, we have the circulation of CRF. And here you may see the connections between, and the fact that this cluster of eye drug users represent Romania in red in this chart. So in this very moment, we discuss about almost 4 different clusters. 2 clusters for IV drug users, 1 cluster for the former cohort of children, and a cluster for heterosexual transmission. And this is in connection with hepatitis G genotype. If in general population we have genotype 1B, more than 99% is genotype 1B. Yeah, in this particular group of IV drug users, which recognize also HIV infections with CRF14BG, they recognize also different genotypes, mainly genotype 2, 3, 4, and with all the subcategory. And when I are looking to the sequencing of those viruses, we see that the genotype 1 and B in this group, it's almost equal, but we have genotype 2, 3A, 4A, and 4B. Of course, this will raise a lot of discussions, what type of therapy we're supposed to use, due to the fact, for instance, that in genotype 2, we have to use sofosbuvir plus ribavirin, only in this category of patient, but for the other, sometimes we have to say exactly which scheme is supposed to be more efficient. So in this moment, we may say HIV and HCV transmission occur independently in the Romanian IV drug users. At the same time, we may say that HIV transmission event is generally more recent than the hepatitis C associated in those which non-heroin injections. Starting from this point, we have some hotspots in Romania. You may see on the chart. Yeah, it's Bucharest, it's the Black Sea, it's the north of Moldavia, and the west part of the countries. And we are looking carefully to see how we're supposed to interfere with this new epidemic wave. Thank you very much for your attention.